Well, there's a lot. Hypothetically, if you were a human resources director with a public health background, or you were a manager of the wellness program at whatever company you're at, there's many steps you would go about implementing a program. The first thing I would recommend would be to do your research. You need to talk with management and see what they're willing to do, what they want. It'd be useful to survey them, and then once you finish that step, I would recommend to do some research on your sample population, your employee population, and find out what are the health problems that they're suffering from. And then once you have all of your information, you could design your program accordingly. But also your program is always limited by your resources you have. So in addition to surveying your management and employees, you need to do a research or a survey on what resources you have: financial, material, logistics, and whatnot. Once you have all your beginning stuff, you can start to design your program, which leads to the next step of implementing it.
So from a practical standpoint, after we had all the forethought and pre-planning, our plans for an employee wellness program really came through fruition with the Keep on Pace program. And this program is an employee wellness program that we started with PACE, and that's the company name. Just to give you a little background, they're essentially a nonprofit government organization in downtown Los Angeles, and their administration had heard about our desire to work with them and collaborate and to bring in a sense of wellness and the concept of keeping up with employees' health, not only for the health of the company, but also for the health of the individuals in the company. So the Keep on Pace program, here's a little synopsis of it, but I'll tell you about it since it might be obstructed from view. But essentially what we did is we went in, as Kai said earlier, and spoke with administration. We talked to human resources and the director, and we basically fleshed out some ideas, like what was feasible and what wasn't, timing, when employees would be most able to come in, and how it would work in their system. Because essentially, we are there to mold our program around them. It's very customized, it's very individualized, it's tailored to them. If it's not tailored to the company and to the employees, it's not going to work, because we need to make it as easy and convenient for them as possible. So what we did was we found a convenient time, and it was Friday during lunch, and so we agreed to come in weekly, and a group of presenters would come and we would present to them. I'd say it was semi-traditional in the sense that we came in with a presentation in the form of a PowerPoint, but it was more interactive in that we had demonstrations and presentations. Oftentimes we had guest speakers, and then we also required that they participate, and we made it really fun for them and really engaging, because our whole goal was to get them excited to take control over their own health. So we didn't want it to be really mundane and really boring. And also one thing we noticed about this program, and one thing that you'll notice about older employees, is that they're less apt to pay attention when you lecture them, because their schooling style and their education background isn't the same as the ones that we experience here at the university. So we really had to adapt to, I guess, the generation gap and also the education gap that we had with that, and really service them in that way. So after we decided that we were going to come in once a week, we thought about how we incentivize the employees to participate in the program. Many of them want to go out for lunch, many of them don't want to sit through an hour of talking, and so we decided that, well, if altruistic reasons aren't incentive enough, then we might as well use some healthy incentives. So what we did was we gave out raffle tickets, and we also brought in little door prizes for them and whoever attended. Because attendance is kind of a really good mile marker to how well your program is running in the company. Obviously, if you have great attendance the first session and then it starts to dwindle, you need to kind of reassess why that's happening. So we can't make it mandatory for employees to come, but we would like to see consistent attendance, and that way we could also better track their progress, because someone who attends all sessions will ultimately make better choices and be more informed than someone who attended sporadically. So what we did was, returning back to the raffles and incentive prizes, that we found that worked really well, and a lot of these employees were excited, and they started competing with one another who had the most raffle points, but in a very playful, friendly team manner, and they were all looking forward to the end, because at the end we had a big raffle for like larger prizes like juicers and digital scales and gas cards and gift cards to health food stores, things that would help them in their journey towards getting healthier. And so I guess I should start by telling you how we chunked our time with them. Since our time was limited with them, we had a 5-week set. And in the 5-week set, we would go through a number of topics, and each week a new topic would be covered. For example, week 1 was stress, week 2 was vision, week 3 mental health, chronic ailments, things like that. And the reason why we chose those topics were because those were the topics that were of the most importance to those employees. Kai said the importance of surveying your sample population first, and these are the things that we gathered from them that was important. And we also threw in a couple things that we thought were important that they needed to be aware about given their age, their demographic. We worked with minority populations, and as you know, minority populations suffer from different conditions at like differing rates than like maybe the majority population. And also they're an urban population, which makes a difference too. And so we took that all into consideration when designing our program for them. And so when they came in, they would sign in, they'd sit down, they'd listen to a presentation, and then they would interact. And based on their interactions, we could gauge how we were going with time and whether they were attentive enough to sit through a little bit more, or maybe we'd have to like cut it short. But the standard time we were there for was about an hour to an hour and a half. And this was something we had to negotiate with the company, and they were more than willing to accommodate. And the hour and a half stretch wasn't that bad, because normally they only get an hour, but we had administration attend regularly. And so they were very like sold into our program, and they really believed in the quality of education that we were bringing to them. So after the program ran its course, 5 weeks had passed, we kind of did a final assessment. And we wanted to see if the employees had changed from week 1 to week 5, and we noticed that they were really happy with our program. And we didn't just notice this at the end. I mean, throughout the whole set, the 5-week set, we were constantly getting feedback from both admin and the employees and participants. And we got this in terms of like small focus groups, individual communication like via email or phone, and also surveys. We would hand out surveys, and we would kind of sample what information they retained. So it was kind of like a knowledge retention quiz to see if this was really getting through to them. And we also asked more I guess subjective questions, how they felt about the program, what could be improved, what they didn't like, what was working for them, so that we didn't have to wait till week 5 to shape the program better. We were constantly revamping the program and really just forming it to them and their needs. And that's essential. You have to be flexible. You have to be willing to work with your population. You have to engage with them like almost, you know, consistently. And they'll be really willing to talk to you about it because they're excited about the program too. Actually, we all were really surprised at how well the program was received. People were really active. They were thinking about it, talking about it throughout the week. They were excited for us to come on Fridays. And I would like to think it was more than just for the food that we'd bring in on Fridays for them. But yes, at the end we did survey them, and like everybody was completely content with the program. We asked if they would like to continue the program and perhaps do another 5-week set, or how they would like to see the program sustained in their company, and all of them showed great enthusiasm in keeping a program like this around. So I think that just attests to the need and the desire for employee health promotion programs in the corporate world.